Hello everyone, this is Dr. Miss again. Let us now discuss what are the clinical signs we get in aortic regurgitation. Okay, this is very commonly asked during the daily rounds if you get a case of AR or even the exams like vivas, etc. Right? So this happens because what happens during aortic regurgitation is during diastole especially all the blood is pulled up in the left ventricular bag. Right? That's why the diastolic pressure is decreased. There is a sudden collapse. That's why we'll get the findings like wide pulse pressure and other clinical findings. Okay. So coming to the peripheral signs of AR, one is Corrigan's pulse, also called as dancing carotids. These are nothing but bounding, forceful pulse that are collapsing quickly, right? And next is Quincke sign. These are pulsations from the nail bed, capillary pulsations in the nail bed. Next is Demosi sign, head bobbing with the each heartbeat. Next is Muller sign, that is pulsation of the uvula. Next is Trop sign, pistol shot sounds over the femoral arteries. Next is Dorozia sign, that is systolic and diastolic bruit over the femoral artery. Nice. Then Hill sign, that is higher systolic blood pressure in legs compared to the arms. Next is Becker sign, that is renal artery pulsations. Okay. Next we'll see the cardiac signs. Okay. First we'll get hyperdynamic precordium, that is hyperdynamic apex beat. Right. This is because of the left ventricular hypertrophy. Yes. So we'll get visible or palpable forceful cardiac impulse. Right. Next is displaced apical impulse due to left ventricular dilatation, as I said. Next is Austin-Flint murmur, that is not typical of AR. In AR we'll get early diastolic murmur, right? But Austin-Flint murmur is mid to late diastolic murmur that we get in severe AR, that is low pitched and rumbling type. Early diastolic murmur, that is high pitched and decrescendo murmur will get in AR. Next is systolic flow murmur can also we get due to increased stroke volume. Next is wide pulse pressure, as I said, because there is elevated systolic and decreased diastolic pressure. Okay, the normal pulse pressure is 40 to 60, right? Next is what we get in general physical examination, GPE. We'll get bounding peripheral pulses, right? Like a Corrigan pulse in the carotids. Even in the brachial artery we'll get, that is called as locomotor brachialis. Similarly, dancing brachialis artery. Next is pallor, we can get due to peripheral vasodilation. Next is fatigue and dyspnea. These are signs of chronic heart failure. Next is orthopnea PND because of pulmonary congestion. That is indicates worsening of the heart failure. Right. Next is what are the signs of severe and acute AR. Okay. Severe AR patient will have gallop rhythm, that is S3, from significant LV volume overload. Next is pulmonary congestion, as I said, there will be signs of crackles or wheeze. In acute AR, there will be the signs won't be there because there is very less time for the compensation, right? You will get cardiogenic shock or pulmonary edema, right? So this is just to remember head, nail, heart and pulse. Head bobbing called as Demosi, correct? Nail bed pulsation, Quincke. Bounding pulse is Corrigan's and pistol shot sounds Trops. Thank you.